Yes, I designed creativity therapy. Maybe some 20 years back, living just as a researcher without any income, without any proper food even, I really felt like how a so-called depression, even how a mental illness, a confusion, a severe sense of meaninglessness, a severe sense of nothingness gradually grasp the so-called mind and gradually extend its tentacles to trap you. During those times, I challenged myself. I am a creativity researcher, and how can I be mentally disturbed? I knew the story of Sigmund Freud, the giant of clinical psychology, and even great many geniuses in the history of the world, even how they had been affected by so-called mental deviations and even went to asylums for treatment. So I said to myself, I just cannot, I will not be accessible to such disturbances. So I thought, if creativity is my area of research since the beginning of my awareness, as a postgraduate student in psychology, I thought I would discover a methodology to manage the problems of the mind. So I designed some perspectives and concepts and ways of attention. Of course, much later I named it as creativity therapy. Yeah, it is called creativity therapy because there are, let's say, three spokes of the wheel of creativity therapy. One, it depends on the creativity of the very so-called patient. Creativity therapy works, of course, based on the creativity of the therapist and the creative elements involved in the concepts or the words and sentences contained in the dialogue of the therapist to the patient. How, by Socratic questioning, the patient is made aware of the situation. So creativity therapy is a kind of a conjunction of three creative tendencies. One of the patient, used by the therapist, by creative communication. That is creativity therapy. Yes, of course, every methodology has its basic assumptions. The basic assumption or the premise, or I would say the theoretical fact as far as I understand, is that a so-called mental illness is nevertheless a creation by an individual. The so-called patient creates the mental illness, the mental problem. It's a creation by the individual. Okay? And every human being is basically creative. Not necessarily in art, music, physics, chemistry, engineering, technologies and politics, etc. But basic element of creativity in every individual. So that creativity is happening by focus of attention on a problem or a confusing puzzle and so on and so forth. So by that creativity of the patient, a certain illness is created, and using the same creativity that the foundations, the linkages of that problem could definitely be disentangled, and a new perspective can be installed there. There is no therapeutic interview or anything like that. In fact, the patient is not encouraged to describe in detail his problems or her problems. The basic theory of creativity therapy is that the time the patient recollects all the details of his problem in a systematic situation to a therapist, that again reinforces his or her problem. So, as much as possible, when the patient is very enthusiastic about describing his or her problem, the therapist has to gently intervene and divert his attention to the next step. In other words, creativity therapy is about the next step. When the next step of when a shift in perspective happens, then the previous state of mind setting and the mental process, the design and setting of the mind definitely changes, which results in a different process. That is creativity therapy. In fact, my trainee Veena Ganesh, she has become a master. She has already must have treated at least close to 200 people without any advertising or anything like that. And every time she does wonder with the patients. Yeah, of course. You are welcome to understand that. Anybody can be trained in creativity therapy, yes, so that it can benefit them in this current and ensuing world of volatile, uncertain, complex, ambiguous, dangerous, unethical kind. It can help definitely people to manage depressions and disappointments and frustrations and worries and even bordering cases of feeling lost in a so-called mental illness. It is much, much, much better than just taking some tablets and destroying the process of the brain and getting rid of it. Yes, creativity therapy is the therapy of brilliant people. And it is very self-enhancing because though it is named creativity therapy, by the same methodology one can even reach really the satori, no doubt about this. It is at that level of a methodology. Thank you for listening. Yes, wonderful questions.